Hello, everybody. I am so excited to be able to do this live stream with you guys. This interactive, what's going to be and function as an interactive workshop because I think it's extremely important. And I wanted to be able to let you guys know a couple of things that may surprise you. So, number one, did you know that when you are getting blood work from your doctor, that they are reading it based on the results are being read based on a range that are so incredibly broad that by the time that you are outside of these range, your issue has likely gone chronic. This is the reason why so many women go to see their doctor, they walk out feeling super hopeless and frustrated because they're told that their issues are normal when they don't feel normal. And the reason why is because you very well could still be symptomatic and be within these very broad lab ranges. Number two, did you also know that to evaluate the thyroid's function, yes, we need a full and complete thyroid panel, of which your doctor is probably not doing, and a lot of this comes down to insurance cuts, etc. Sometimes there's a little bit of ego wrapped in there as well when they're like, oh, you don't need those other markers. And that's really frustrating because unfortunately the markers that they are testing you for, generally speaking, really only gives us just a slice of the picture, and I'm going to be sharing a little bit more about why that is and why we need all these other markers. So that's also a fact that I want to share with you guys, and also that to understand how your thyroid is performing isn't just your thyroid labs. In fact, we can get a lot of juicy tidbits on how your thyroid is, what other things that might be impacting your thyroid, other markers that help us to understand, oh, maybe there is some thyroid function. So I'm going to be actually sharing that with you guys today. I'm also going to be sharing with you guys where you can get your labs done because we do offer resources. So I want to share a little bit about that today because I think so many people are slipping through the cracks, and I really don't want that to happen because then women leave, they feel devalued, they feel dismissed by their doctors, and oftentimes they're told that it's all in their head. And who wants to feel that way, right? All right, so if you guys are interested in all this stuff, do me a favor, give this a little thumbs up. Make sure that you are subscribed to this channel. I publish videos on my channel every single Wednesday, and there are videos that are coming up from autoimmunity, hormones, even trauma, and once a month I also do a live stream so that they become more interactive and I get this amazing opportunity to be able to converse and to chat with you guys. So make sure that you are not staying quiet, leave me comments, but just also know that what I'm going to be answering today is going to be on topic. So if you're asking me something completely off topic, I'm probably not going to answer it because I want to respect everybody else's time. Okay, so in this live stream, we're probably going to get to around the 45 minute mark. I'm going to try to keep this as condensed as possible just because I know y'all are busy. All right, so with that said, let's kind of go based on the first thing that I was talking about, which is about lab ranges. Lab ranges, the fact that they're so broad, they're actually based on a sick population, okay? And this is pretty crazy because it really comes down to a doctor, I should say practitioner, so we can kind of loop in even alternative practitioners, whether it's a naturopath or a functional health doctor or functional health practitioner like myself. It really comes down to the definition of what health is. And with thyroid dysfunction, a lot of stuff can be really preventable. A lot of things we can kind of, get in there and be able to figure out what's going on so that you can start to feel better. So you don't feel so tired, so that you don't, maybe have constipation, or that your hair is not falling out, or you aren't struggling with all the emotional upheaval that oftentimes can come with thyroid dysfunction. And just a caveat, not everybody who has hypothyroidism has added weight. Okay, so you could be thin and also have thyroid dysfunction as well, just a side note. The ranges that practitioners like myself read labs in are based on functional ranges. And these ranges are going to be more narrow, and that's what you're going to be seeing today. Those are the ranges that your body is required to function in. Okay, and that's where we can see when you're symptomatic, things that, can really highlight to us, okay, this person really does need support. So we're going to go through some of these these blood markers, but also some other blood markers that very well are part of it. The other thing that I want to share with you is oftentimes when I work with women, especially when it comes to blood work, we work with them in my hormone membership program called Sexy Lady Balls. The program was initially designed for women who had PCOS, but then it broadened because so many other women were coming to us with hormonal issues. The thing that I want to share with you about this is that with blood work, oftentimes you're going to have to go out of pocket to receive like a requisition that's going to have full and complete testing. This always trips women up, and I hate to say this because I am Canadian, but Canadians, you guys are the worst, and I say this because you're not used to paying for the things in your health. You're used to going to your doctor, walking out, and not having to pay for anything. Americans, on the other hand, have to pay for literally everything under the sun when it comes to their health. So the reason why that I say this is because, for example, if you remember with us in Sexy Lady Balls, we have resources, whether you are in Canada, whether you are in the US, whether you are in Australia, whether you're even in the UK, on where you can get your blood requisition that will have the full and complete labs there. But you will have to, it will be an out-of-pocket expense that doesn't go to us, it goes to the actual lab. Then what our job is, and what you're going to see actually when I share my screen in a second, is that you can then upgrade to have us, put together a manual report, which is called a blood chemistry analysis. Blood chemistry analysis is actually quite important because this helps us to assess patterns that are happening within your blood work. And this is precisely the reason why that when women try to cut corners with their health, and they'll say, well, I'm going to get what I can from my medical doctor, even though I warned them, okay, you're going to go in for labs today. If you're going in for labs today with your medical doctor, I can pretty much tell you that about 98% of the time, you're going to walk out frustrated because they're probably not going to test everything. And this is the category of women who will say, well, I'll just get what I can from my doctor, and then I'll pay for all the missing ones, the rest of them. The reason why this tactic doesn't work is because of the fact that when we are evaluating patterns based on blood work, they all have to be done within the same time. Because if you're getting blood work done on a Monday with your doctor, and then you get the rest of them done, say, on a Thursday at 2 p.m., it's really not going to help us understand because they were done at different times and your blood changes. So we need to have them all within the same time frame at the same point, because in that way we can evaluate patterns. This is extremely important to understand because I think people try to cut corners, and when you cut corners, you're going to be frustrated at the end of the day. I know there's people asking questions right now, so please just hold on to those because I can't start, diverting into different topics, etc. So please just hold your comments or your questions for just a second. Go to your bed. Go to your bed. Sorry, I have my dog here. All right. So what I also want to be able to share with you guys, we talked about how you have to get them all done at one point. So Lady Bell, HGHI, all the people who are asking me questions, please hold your questions. Hold your questions. We'll get to them, I promise. Okay, so I am going to see if I can share my screen. Would be amazing. Current application, Google Chrome. Let's see if this works. Will this work? Will this work? All right, let's see. If not, it's not a big deal because I can talk to this as well. Entire screen? Do you want to share it? No? Current application? No? All right. I'm going to hop back on screen. All right, so let's go through some of these right now, and I will just talk to these because obviously my screen does not want to share, which is totally fine. So let's go through the first thyroid marker, and I just want to also let you guys know, in case you're like trying to scramble to write all these things down, a full listing of all the thyroid, the thyroid labs are listed within my thyroid 411 guide. So all the thyroid labs are listed there, plus all the functional ranges that I'm going to be speaking about today. Okay, so if you want a reference of all those ranges, they're all going to be there for you. So I just want to let you guys know that. Okay, so the first one that we are going to go through that I think is generally what women are getting tested is their TSH. That stands for thyroid stimulating hormone. And yes, probably Mercury retrograde does not want to work with me with sharing my screen, but that's okay. We can do it without it. So TSH is your thyroid stimulating hormone. What that helps us to assess is how your brain is communicating with your thyroid. Your brain essentially is like this master controller. There are glands in your brain. I'm going to try to keep this as simple as possible. And they communicate to your adrenals, but they also communicate to your thyroid. So your TSH is one that your doctor likely is testing for, but generally that's the only one they do test for. If they do another marker, they'll probably test T4. Those two things alone are not enough to help us to understand your thyroid's function. So the lab range for TSH is, just like any lab range, is actually really, really, really broad. And to give you a concept, the lab range for TSH falls between 0.4 and 4.0, okay? So 0.4 to 4.0. The reason why that I'm mentioning this and how absolutely bananas crazy that I think that this actually is because the functional range is 0.5 to 2. So 0.5 over to 2, okay? Versus the lab range is 0.4 to 4. So you can see how way more narrow it is. So let's say if you are if your TSH is 2.5, then you, from a functional perspective, have hypothyroidism. You have primary hypothyroidism. And that's something that, is a red flag. But if you went to your medical doctor, then chances are they're going to say, it's normal. But you're likely going to be very symptomatic at that point. You're probably going to struggle with fatigue and maybe some depression. Maybe you're going to have struggles sleeping as well. Maybe your sex drive is going to be lowered. Maybe your hair is falling out. Maybe you're starting to struggle with weight gain. All these things can very much be symptoms that you're struggling with if you are outside of that functional range, which is 0.5 to 2.0. Again, guys, remember, if you want a copy of all these functional ranges, plus even some tools that I use with patients that I've used for myself, it's all in that Thyroid 411 guide, so make sure to grab that. Then the other markers that we want to talk about from a thyroid panel perspective is free T4 and free T3. So free T4, I just want to be very clear, T4 is your inactive thyroid hormone, and T3 is made from T4. We actually synthesize this active thyroid hormone from T4, and in a lot of cases of hypothyroidism, T3 will be very low. So what we're looking for specifically is free T3. Again, those lab ranges tend to be quite broad, but if free T3 is low, which this is a marker your doctor is probably not testing, and that if you end up having low levels of T3, we're looking again at hypothyroidism, okay? Primary hypothyroidism and even selenium deficiency, potentially, okay? And this is important for us to be able to truly evaluate in an individual because, imagine you're going into the doctor and he's like, yeah, everything's normal, but you are outside of the functional range. Those are narrow, amazing functional range, but you're within the lab range. And then he's only testing T4. So now we're not getting a full picture because free T4 and free T3 helps us to understand now how your body is responding, okay? And that is a really important part of it. So are these the only markers? So we have TSH, free T3, free T4, but there's more. There's also a marker called reverse T3. Now, I actually spoke about this on my Instagram. If you guys are not following me on Instagram, do me a favor. You can go on Instagram and just check out Sexy Food Therapy, all one word, and you will find me. But I actually did a post about reverse T3 and that it actually is extremely important to test this. So the range that you want to be in, you don't want to be with reverse T3, and I'm just going to put this in our little chat here. You want to make sure that you do not want this marker. And again, this is something that your doctor I can put money on that they're not going to be testing this. In fact, this is a marker that definitely is going to be out of pocket. So generally this marker costs about $50 to $60 just to test this marker. And you don't want this marker over 15. And here is the really interesting thing that often trips people up when it comes to labs. Depending on the state, depending on the province, depending on the lab, the units of measure that are used are often different. So in case, like I had a woman in Australia who was like, well, that's not, what does that mean for us in Australia? Because the unit of measure is different. And the unit of measure might even be different in parts of Canada, in parts of the States. So I want to share with you a resource that we actually use in practice to help us easily do the conversion of it. So to easily do conversions for units of measure, you can go to a website called unitslab.com. And it's really simple because all you have to do is look at your lab work and go, oh, 15 ng/DL, okay? And you're gonna go to Units Lab and you're gonna look up reverse T3 and you're gonna punch in that number, okay? And then it's gonna spit out what the number actually is, maybe in the units of measure that your blood work is tested in. So it's a really handy resource to have, so you don't have to math, you don't have to do anything. All you have to do is put in, search the blood marker on Units Lab and throw in the number, and then you can see what that number translates to easily, based on maybe the unit of measure that the lab or the state or the province was testing it in. So it's a really handy dandy thing. The reason why I bring up Units Lab is because in Sexy Lady Balls, my hormone membership program, when women bring us their lab results based on, the person that we tell them, hey, go get your labs from this person, you'll probably have to pay out of pocket, or that you will have to pay out of pocket. I always do with my own health because frankly, I'm worth it. I want to get answers. I don't want to be cutting corners with my health because I have found in the past it just leaves me feeling more frustrated. But when we do, we put it into a report, and it takes us a while to be able to make sure all of the units of measure are based on what we have in this report. So we actually go into Units Lab and we use that as a frame of reference. So I want to share that with you guys because it's pretty freaking handy. And will probably help to give you guys a little bit of answers. So reverse T3, let's talk a little bit about this marker. And I want to share a little bit about what I actually put in on my Instagram, just to kind of give you a frame of reference, because a lot of people don't understand why this is so important. If you are over the number of 15, which I listed there, generally speaking, this is where I look at stress in the individual's life. Really important to assess that, because if you're super stressed out, cortisol, which is the hormone released in response to stress, is going to prevent the conversion of T4, your inactive thyroid hormone, to T3. Okay, so your T3 is going to be low, and what will happen is that it will shunt it down into what I call like a dud, like a dud thyroid hormone, which is reverse T3. So oftentimes people who are like crazy stressed out, they're managing their stress really poorly. And guys, I say this without judgment. I know that life is really stressful, but if you are not valuing sleep, if you are not valuing things like meditation, breath work, etc., these are all components that we help women with in Sexy Lady Balls. Equally as much as you're valuing your supplements and your food, you're really going to struggle. Most often women will complain to me about how expensive all this natural health stuff is, but they're not doing some of the few things in life that are free. So just saying. All right, so reverse T3 levels should be tested. Okay, really, really, really important. So it is a biologically inactive metabolite of your T4 inactive thyroid hormone. So I see this, like I said, as a dud thyroid hormone. It's actually an antagonist to T3, your active thyroid hormone. The two will actually compete with one another on a cellular level. So oftentimes we'll see low T3 coupled with high reverse T3. As I mentioned, when you're not converting to T3, it'll shunt it down to reverse T3. But the first thing I always inquire about is stress. The reasons why reverse T3 oftentimes can be elevated in people, there's a multitude of reasons. Stress is definitely a big one. It's the first thing I look at, if there's any trauma that's happened, especially in the recent bit. Heavy metal toxicity, low-calorie diets, crash dieting can definitely make a surge of reverse T3. If you have infections, ladies, every single one of you guys who are listening and who are, obviously you're here because you want to understand your thyroid labs a little bit better. You have to remember that your thyroid issues are symptomatic. They're very much a symptom. So when we're seeing thyroid labs as something symptomatic, we have to understand, well, what's causing your thyroid labs to be out of whack? And one of the big reasons is your gut function. So another reason why reverse T3 also can be elevated is due to pathogens like parasites. Parasites are freaking huge. Parasites, bacterial infections are probably one of the most common things I see with thyroid dysfunction right now with women. I'm actually going to loop back on that point in a bit, because even if your T3 is really low, if your TSH is high, I always want to evaluate the gut. And this is precisely why in Sexy Lady Balls, our membership fee is so low. But we do that so that you get the base that you need and the support that you need. You're never going to get hormone support for the price of what Sexy Lady Balls offers you, but that allows you to have room and wiggle room so that you can upgrade to get testing. And one of the testing that we suggest highly, just on the topic of poop, is stool testing. It's called the GI map. So if you joined us in Sexy Lady Balls, the next page that you would get taken to is to upgrade to get our stool test. And it's like the number one test that you have to get if you've got thyroid dysfunction, is to rule out parasites, bacterial infection. I cannot even stress how important this is. And it absolutely can create a surge of reverse T3. Liver and kidney dysfunction is also potentially a causative factor behind high reverse T3. Various nutrient deficiencies. So if you have low iron, if you have low selenium, these also can definitely make a surge in reverse T3. And so many women will say to me, I have low iron. We're going to loop back into this because I told you guys this is going to be an extremely jam-packed call. So I hope you guys are writing notes here. But the answer is not necessarily to take oral iron. Oral iron is something I never do with women because I don't think it works. And side note, oral iron, so as in iron supplements, they feed parasites. And parasites are fascinating, at least to me, but incredibly intelligent creatures, okay? They feed on iron, and they absolutely can become more virulent and more opportunistic. So we have to be careful with that and really identify what is causing your thyroid issues to go out of whack. Let's address that head on. And one of the biggest things to do is to address the gut, which is the reason why in the membership we do offer the opportunity to upgrade to get stool testing done. Okay, so you can be working on your gut big time. As Susan said, I'm really happy for you, but if you haven't tested, which I obviously can't make that assumption with you, Susan, because I don't know your case, but if you have not gotten stool testing done, you're missing a massive picture simply by guessing versus testing. You're going to end up spending way more money in the long run. Other things that can create a surge in reverse T3, and I promise I will move on, is poor blood sugar management. So if you're somebody who is eating 5 meals a day, if you're eating a high carb diet, if you are eating lots of processed foods, lots of sugar, your blood sugar is going to be so out of whack, and you're going to be eating, and then you're going to be hungry 2 hours later, and then you're going to eat again. You might feel hangry. You might have insatiable cravings. Sometimes those cravings is not about you. Sometimes those cravings is because you have a parasite. It's not you, it's the parasite. Other types of medications that also can create, remember all these things, guys, that I'm mentioning that can create the surge in reverse T3 is stress on the body. Stress isn't just mental stress. Stress is also heavy metals, parasitic, inflammation, all that, even medications. So certain beta blockers can do this. Also is huge. Even with testing, aren't parasites easily missed? Well, yes and no. It really depends on the test. And Steph, I'm really glad you asked that question. And I am going to answer that because it's on topic to what I'm currently talking about right now. What the biggest thing I always say is methodology matters. Okay? Are all tests perfect? No. But that's the reason why in practice, I often always say to people that it really comes down to, we don't address paper, we address people. So women sometimes will like randomly message me, even on social media, and give me all their lab results, like list them up. And I'm like, I don't know what you want me to say about this, but I don't know you from an apple. So without context, I really can't say what's going on, right? So yes, is testing perfect? No testing is perfect, but definitely there are other tests out there that can miss a lot. The stool testing that we run, again, methodology matters, which is extremely, extremely important. So that is something I just want to be able to share. So not all tests are created equally. And so again, so Vicky says low reverse T3 8.1. So is that a little bit low? Yes, it's definitely on the lower side. But again, we have to look at the entire context and picture to understand, why is it at an 8.1? What do the rest of your labs look like? For me, I would probably say to you that your T3, your active thyroid hormone, is definitely probably low as well. You may have an iodine deficiency, but that is something that I'm going to strongly advise you. Nobody here should ever take iodine without the guidance of a qualified practitioner who knows how to work with iodine. And I say that because so many women take iodine and then it shoots their antibodies up, which we're going to talk about in a second. And when your antibodies go up, it certainly can make your thyroid issues so much worse. Because high antibodies also signal a thyroid autoimmune condition, which 97% of women who have hypothyroidism have. So the majority of the times, thyroid issues are autoimmune related. And side note, guess what? Your doctor is not testing your antibodies, which is another thing that I tell women, even though they're like, I'm just going to ask my doctor. I'm going to see what he can do. And then they don't do it. And then they want me to perform miracles, wave the God wand and go, what's wrong with me? And I'm like, well, fuck if I know. I don't have all the numbers that I need. So like, invest in yourself and do the proper work required. So Lady Bell, you probably didn't hear what I said, so you guys need to listen to me here. He said, what iron do you usually recommend? I just finished that I do not recommend oral iron. Why is the iron low? The iron is likely low due to parasitic infection. The low iron also could be very much a cause due to other factors, which we're going to break down in a bit. So antibodies that you need to get tested. Again, guys, remember, all this information is in my free Thyroid 411 guide in terms of the listing, the functional ranges, etc. So grab that guide if you haven't already. So the first thyroid antibody is called thyroid peroxidase antibody. This is kind of a big, long one, so if you're struggling to write this down fast, remember it's in that guide. So just simply download that guide and you'll have it. So the first one is thyroid peroxidase antibody, okay? So you want to make sure that that is under 10. And when I say 10, here is the unit of measure for your thyroid peroxidase antibody. Sometimes you will see it listed on blood work. And you want this under a 10. So it'll be listed as TPO antibody. So if you're like, what is that? That's what that means, okay? Thyroid peroxidase antibody. That is your first thyroid antibody. The second thyroid antibody that needs to get tested is a thyroid antibody called thyroglobulin antibody. It will be listed on your lab work potentially as TBG antibody, okay? And that should be under 20, all right? Oftentimes when I see thyroglobulin elevated, like outside that range, one of the things that I also try to investigate is there high estrogen in this individual's world? Is she eating out of a ton of plastics? Does she have commercial cleaning products in her home? Maybe we can sort of, you can try to detox and love your liver, all of these things. But if the exposure in your world is still there, you're going to continually retoxify yourself again and again. So this isn't to say, okay, throw out everything in your beauty bag, but maybe, if you're done with the foundation that you're using, maybe you can switch to Beauty Counter, you know, something that's a little bit more not toxic. And there's a whole ton of brands that are out there. Beauty Counter is the one that I personally love and have used. I really like their products, so I'll just put that there as well for you guys as a reference. So those are your thyroid labs that you need to make sure that you're getting tested, okay? Because that's a full and complete thyroid panel. However, it doesn't stop there. And the reason why that I say it doesn't stop there is because there's other labs, things on your lab work that I also like to look at. And we're going to start off with the one that is probably the hottest topic when it comes to thyroid blood work, which is iron levels. Notoriously, women have low iron who have hypothyroidism, and the reason why that I bring this up in the context of this call is because of the fact that sometimes your doctor is only testing your iron. They might be listening to this going, isn't that what he's supposed to test? Well, they also should be testing a marker that is also called ferritin, okay? So ferritin is actually helps us to understand how much your body is storing of that iron. So the reason why it's important to get this tested is because your iron levels could be normal, but then all of a sudden your ferritin levels get tested and it's brutally low. So your ferritin should not be under 50. If it is under 50, you very well could struggle with hair loss. You can struggle with fatigue, you know, really pale skin, maybe dull skin. You could have experienced what's called air hunger. And the reason why is because if you have low iron, you probably will have very low oxygen reserves as well. So you might find yourself going, like trying to take this deep breath and really struggle with it. I know that this is something that I have struggled with because my iron levels were notoriously low. And in my case, it was very much parasitic. And I don't suggest taking oral iron supplementation, as I mentioned previously, is because of the fact that iron feeds parasites. But why do I bring this up in the context of thyroid dysfunction? Well, I bring this up in the context of thyroid dysfunction is because if you have low iron, guess what? You can't convert T4 to T3. So this is another reason why you may struggle with that conversion of T4 to T3. So Michelle says, is this UG? Yeah, okay, so let me actually give you, I apologize. So ferritin levels, thank you for just flagging me on this because I want to make this as clear as possible. So ferritin levels should functionally be between 50 to 100 Ng/M capital L, okay? If your ferritin levels are high, it absolutely can be due to inflammation. Again, the gut needs to be evaluated and the liver needs to be evaluated. So we want to look at the entire context because just saying my ferritin levels are high is not really helping us understand why. One of the things you can do, which is kind of more of a symptomatic support here, because I have seen women with very high levels of iron, is you can donate blood. And that is a symptomatic thing while you're addressing why is the ferritin levels high, but that's going to require additional testing. So that's one of the things. So we want to make sure that we're not taking oral supplementation, but we need iron to convert T4 to T3 so you have enough active thyroid hormone. Other reasons why that your storage iron could be low, vegetarians will generally kind of be looped into this mixed. And the reason why is because not all protein sources are created equal. This is not me being an anti-vegetarian, an anti-vegan, etc. My main focus here is on your health. And so I say that, but notoriously, when I see women who are struggling with low iron, my biggest question is not what can I give you, but why? So is it parasitic? Are they on any vegan or vegetarian diets? And another thing is I look as, have they had any birth control in their current or past history? And now you might be someone who's like, yeah, I took birth control back in uni, and that was maybe in your university days, like 15, 20 years ago. But the reason why I bring that up in the context of this discussion is because oral birth control, so we're talking specifically about the oral birth control, is loaded with copper. Copper can then lead to iron deficiency. It's actually a very huge reason why women have iron deficiency. Anemia is due to elevated copper levels. And even if you took the birth control 15 years ago, it 1000% could be the reason why that your iron levels are so low. It also could very well be the reason why you may be also subsequently struggling with estrogen dominant type conditions, like whether they're fibroids or persistent, painful ovarian cysts that rupture like popcorn, or maybe if you have endometriosis, it's worsened by it. Endometriosis is not caused by elevated estrogen. It's worsened by it. Endometriosis and things like hypothyroidism, even PCOS, are very much interrelated. And they're very much interrelated because they all are associated with autoimmunity. Autoimmunity. Trying to speak. I don't think it's terrible to use a copper tongue scraper. You're just scraping your tongue quickly. But people also ask me about, what about the copper IUD? I don't like the copper IUD. I also am not a fan of the progesterone, which is not progesterone releasing. The Mirena IUD secretes synthetic progesterone, which is called progestin. But copper IUDs absolutely are not, I'm not a huge fan of it either. So this is the reason. These are the base things that we educate women on in the membership. That's huge. Any relation with copper and breast cancer, maybe? I will answer this really quickly. It is off topic to what we're discussing, but because we're not talking about breast cancer, but I will share this. What copper does, it is one of those heavy metals that can absolutely it can increase something called aromatization. Stay with me here, okay? Aromatization, all that means is it's turning testosterone into one of your estrogens called estradiol. It's your most potent estrogen, okay? So yes, testosterone can turn into estrogen, your most potent estrogen. Copper actually increases that conversion. It can actually speed up that conversion. So to answer your question, can copper and breast cancer be related? Yes, it can, in the sense that it can increase estrogen within the system, especially given that breast cancer oftentimes is like estrogen related. Okay, but there's also other factors behind that, which I'm not going to get into right now. I am 90 veg for endometriosis, so ferritin was 11. That's why I asked on iron. That's why I asked what you recommend. I totally understand. The thing that I just will say is that, I am 90 veg for endometriosis. I don't really understand what that means. Are you 90 days vegetarian? Help me understand. Wow, that makes so much sense. My testosterone is ultra low. Yeah, and the question is, why is the testosterone so low? Is aromatization really high? And then the question is, why is it so high? Okay, so we talked about the iron. And so the question then becomes, well, and I literally can do an entire live stream just on iron, but the question then becomes, well, then what do I do? I'm so freaking tired. For me, I evaluate the gut. It's probably the first thing that I do in all hormonal cases, even if it's not a thyroid case. It's the number one test that we run. You might see a lot of practitioners running a hormone test first, but the reason why that we generally don't do this first and foremost is not because hormone testing, which we do via urine, is not that it's inaccurate, because we do run it. It's just I'm more interested in what's causing your hormone levels to be out of whack to begin with. I always say hormones are superficial. So what's causing them to go out of whack? That is really the biggest thing. And so the reason why that they could be out of whack is due to gut dysfunction is a huge piece of the puzzle. So I always want to rule out infections. Okay, now we have other markers. Yes, we're going to go through. And speaking, because I'm talking about, markers on your blood work that are not thyroid labs, but that are associated to maybe why your thyroid's out of whack. let's look at your white blood cells. Now, you might be like, white blood cells? What does this have to do with my, what the heck does this have to do with my thyroid? Well, believe it or not, there is a marker on your white blood cells that is listed, okay? And when I say white blood cells, one of them is called eosinophils. You might not know how to pronounce it, but that's the way it's spelled, but that is how it's pronounced, is eosinophils. When we see eosinophils that are elevated, I am looking at, that is a huge, big ass red flag for parasites. Food and environmental allergies, sensitivities, even possible asthma, but intestinal parasites, that's a really, really big one that I always look at. Even monocytes is another one. And the reason why that I bring this up again, that's the other white blood cell. The reason why I bring this up again in the context of your thyroid is because if these markers, these white blood cells are elevated and you have parasites, you know, a huge majority of your conversion of your hormones are produced in your gut, inhibited, secreted, converted in your gut. So if you have parasitic infection in your gut, guess what's happening? Your thyroid's going to be out of whack. So you could take, you know, this is why women go on desiccated thyroid, which I'm not poo-pooing at all. I'm not poo-pooing, no pun intended here, but I'm not slamming anyone who's on thyroid medication. But this is the reason why that you may have to go back to your doctor and then they have to increase the dose that you're on, because thyroid meds are symptomatic. Sometimes we need symptomatic support, but it's also equally important to address, well, what's causing it to go out of whack? And the gut function is a huge one. Okay, so Lady Bell says, I'm 90% vegetarian. But then if your ferritin levels that are at 11, maybe the diet that you're on is not actually working for you, because 90% vegetarian with the ferritin levels at low, those are bottomed out ferritin levels. So A, it could be that you're not getting the right protein that you require, and B, it definitely could be parasitic as well. And this is me just, you know, generally speaking, because I don't know your case, so it's hard for me to say conclusively. The other thing that I look at that might surprise you about your thyroid's function is your lipid panel. Now, if you might be like, what do you mean, my lipid panel? So cholesterol is one of those markers. Believe it or not, a lot of women who have hypothyroidism will also have elevated cholesterol. And this is when your doctor will say to you, well, you should go on statins. Statins are not the answer. Okay, they're not the answer. Believe it or not, they're giving statin medication to children as young as 6 years old now. Okay, this is pretty startling, and it's scary, and it's terrifying, and this should not be happening. And this is the reason why in Sexy Lady Balls, my hormone membership program, you get access to me. So if you love, like, you know, calls like this, you know, you would love the membership, because we really try to inform women so that they can become an advocate for their own health, because women are notoriously slipping through the cracks of our medical system. So cholesterol, when it's elevated, can definitely signal hypothyroidism. It also, surprise, surprise, can signal bacterial and parasitic infections, viral infections even. So yes, we have to look at the gut again. It also can signal that maybe there is, you know, adrenal fatigue that's going on. Fatty liver, so liver work is definitely required. Is the person's blood sugar being managed? Are they eating every 2 hours? Or, you know, are they eating all the wrong foods? Processed, high carby foods is really going to put you at a disadvantage. So high cholesterol is a big one. Now, if you're someone who has high estrogen as well, the chances are your cholesterol levels are also going to be quite high. And the reason why for that is usually because you will have these increased cholesterol fatty deposits that will then end up depositing as a result of that. So does that mean you have to take statins? No, not necessarily. You certainly just have to address all the reasons behind it. And the biggest thing I like to do when I see elevated cholesterol levels is I like to work on the gut. I like to work on the liver. Remember, the liver is a part of your digestive process. I want to rule out infections. These are huge ones. But the same thing also comes down to things like high triglycerides. You know, we look at liver function. Your liver is an extremely important part of your thyroid's health. So when women are like, what supplement can I take for my liver, Melissa? And then I find out that they're actually not sleeping. And I'm like, you think a supplement's going to fix the fact that your lifestyle is shit? Fix your lifestyle first. Otherwise, none of the things I'm telling you is going to work. You're not going to be able to stay on track with your nutrition. You're not going to stay on track with, all the other things. And then you're going to come back and you're going to complain to me about how this supplement didn't work. But you're actually not showing up for your body when your body is desperately trying to show up for you. Okay? HDL, high levels of HDL, which is supposed to be considered your good cholesterol, is actually associated with autoimmune disorders as well. Low levels of HDL is associated with heavy metal toxicity, potential H. pylori infection. If you didn't know this already, H. pylori is the bacterial infection that is associated with peptic ulcers. But a lot of people have H. pylori and don't even know it because they're asymptomatic. And 2/3 of the world's population has H. pylori, and it's highly contagious via saliva. So the chances are if you have it, so does your partner. So usually what we do, even in Sexy Lady Balls, we have worked with women in that program, in that membership, but we've also worked with their partners as well. So we've given detox protocols or, protocols to husbands as well as the women in our program, because sometimes you have to treat both people. High LDL. So this is, I don't want to get too much into the cholesterol conversation here, but LDL isn't necessarily your bad cholesterol, even though you've been made to think that. Particle size matters. Size matters. And I say that because if you are under a really, acute amount of stress, so let's just say, knock on wood, you get into a car accident, your body's going to produce a lot of LDL, and they do that as a protective measurement, okay? But it's producing a lot of the big, buoyant particles of LDL versus the denser particles of LDL. So buoyant, bigger particles are not exactly harmful. But again, we need to look at the whole picture. We never, ever, ever simply just look at one marker. So if you point out, hey, well, this is my score for my LDL, go, context is everything. And this is something that is often very much wiped out in the overall picture of even nutrition studies. So the coconut oil is bad for you. But what was the context? How did those people eat? Were those people sedentary? Did they sleep enough? Were they really high stress? Did they lead high stress lives? Context always matters. It's extremely important, as it is with your blood work. So if you have the MTHFR gene, it definitely needs to be addressed for sure. So you have to be careful with the supplements that you are taking, especially with B vitamins. And that's something we 1000% can help you with, in the membership as well. I know that Steph French, I'm just going back to some of the comments here, just really quickly. Insomnia is a really big piece of the thyroid picture. And the reason why insomnia is such a huge piece to the thyroid picture is because there could be several layers behind that. Again, I know I'm going to sound like a broken record to you guys, but if there is parasitic infection, that could cause insomnia. You'd be surprised at how common this is. Parasites tend to be more active at night, and they also tend to be more active during the full moon. So sometimes when women say, oh, the full moon really energetically got to me, I couldn't sleep at all. And I'm like, I don't know if it's the full moon as much as it is the parasites that are woken up from the full moon, right? So one thing I would ask you to evaluate is, you might have insomnia, but is it actually worse around the full moon? Really fun, crazy ass fact here, guys, that I just want to share with you. In couples counseling, and I just found this out from Dr. Jessica Pietros, which I thought was a really interesting factoid, since we're talking about parasites. In some couples counseling, they use MDMA, okay, which is also known on the street as ecstasy. Well, guess what? One of the side effects were in these couples counseling for these couples that were using MDMA. These couples were grinding and clenching their jaw. Well, guess what happens with MDMA? MDMA actually creates a surge of serotonin, which is your feel-good happy hormone, but serotonin, there's a very big correlation between serotonin and parasites and worms. So these people who are clenching and grinding their teeth is because of the fact of a surge of serotonin mobilized parasites and worms. So they were getting very symptomatic. So if you're somebody who also tends to get rectal itching, even if it's every so often, or maybe more at night or around the full moon more, or if you clench and grind your teeth and you have thyroid dysfunction, You can work with someone like myself who can really get to the bottom of it by understanding any stealth pathogens that are just like hiding there that need to be addressed. Someone, I know HGHJ asked about iodine in a multivitamin. I think that the amount of iodine in a multivitamin is quite low, but you also have to be very careful. So again, it really comes down to cofactors. You know, do you have enough vitamin C in your body? Are you taking enough selenium? All these things really need to be addressed. Okay. When women also have, and I also want to share this because this is extremely common, when women have high prolactin levels, we have to rule out, are they breastfeeding? Because if you're breastfeeding, your prolactin levels are going to be elevated. But otherwise, if you're not breastfeeding, your doctor will likely want to rule out if you have a pituitary tumor via an MRI. That's usually is one of the things they want to rule out. But the majority of the reasons why women have a high level of prolactin is due in part to hypothyroidism, which then goes down to the rabbit hole of be the annoying kid who always asks why. Why do you have hypothyroidism? You know, so oftentimes I see women's prolactin levels normalized just simply based on the fact that they're finally addressing all the reasons why the thyroid is kind of going out of whack. The last thing that I want to share with you guys, a couple of last markers before we go, is we definitely also want to make sure that we're looking at your glucose levels. So this is the marker why you go to get your blood work on a fasted state. Your glucose levels really need to be addressed. But usually when it's really elevated, there could be a fact of insulin resistance, but we have to see other reasons for that. So that's also something that I will share with you. So glucose is not the only marker to say like, oh my God, this person has insulin resistance, like in the case of PCOS. We also want to look at A1C. A1C. That gives us your blood sugar measurement over the course of 90 days. But elevated levels of glucose can signal B1 deficiency. It could signal fatty liver. This is a really big one. Liver congestion. You know, adrenal hyperfunction. So you feel super like on edge. Okay. And fun fact, if you're over the age of 35, you're kind of going into, say, for example, you're in your mid 40s. If you are a woman who is perimenopausal, women who are in perimenopause have a much higher chance of going into an insulin resistant state. What that means is your body just isn't, your body is essentially saying store fat, store fat, store fat. This is why women end up getting that midlife weight gain and they just can't seem to take it off. So blood sugar management is extremely important. And the reason why I talk so much about thyroid dysfunction is because the prevalence of women who will end up having thyroid dysfunction as they age is so freaking high. And it increases as we age. And the reason why is for several. Number one, when we get into that perimenopausal state, it's reverse puberty, okay? So this is the time in your life where you have to assess, how am I showing up in my life? Because you cannot live your life the way you did leading up to it. Like, shit has to change. Otherwise, you are going to be miserable when you, through perimenopause, menopause, and even post, you will be fucking miserable. Your adrenals bear more weight around that time. Your thyroid bears more weight at that time. So lifestyle changes, mindset, emotional, trauma work, all this stuff needs to be worked on. And this is stuff that we definitely help and support women with in my membership. This is the reason why that the membership is so vital, the base stuff. And as I mentioned before, you guys also will be happy to know that it's an extremely cost-efficient membership, but it gives you all that options to upgrade for testing whenever you're ready. Diane says, Sienna Rose says, is there someone like you for guys? You're very sweet. There's a lot of really amazing people out there for men. You know, I would say maybe Chris Kresser. I don't know if there's also Mike Mutzel. He also has a YouTube channel, very sciencey. It's called Metabolic Mike. But I actually have when people upgrade in Sexy Lady Balls, if their husband wanted to see someone in our clinic, we absolutely can help them as well. So we do help men. Diane says, I have been told I have hyperthyroidism by super low iron and ferritin, exhausted constantly, low vitamin D, low B12, need better labs clearly. So Diane, thank you so much for sharing that with us. And I'm really sorry that you're struggling, because that's got to be really hard. The one thing I also want to tell you, that whether you have you've been told you have hypothyroidism or hyper, I want to share with you guys that you can fluctuate between one or the other. And no matter, even if you have one or the other, the fact remains it's still very much a symptom. So the gut still needs to be evaluated. So Diane, and for anyone watching, I would love to be able to have the opportunity to work with any of you guys to get to know you guys better. And this is the reason why that I urge you guys, at the very least, download the Thyroid 411 guide, because I know that Vicky Hirado says, such great info, overwhelming. Listening to me for an hour will feel like you're drinking through a fire hose. Especially, you're not expected to know this shit, guys. Totally get it. And I try to jam pack everything in within 1 hour. But you'll have a listing of all those labs, at least all the thyroid labs specifically, in my free Thyroid 411 guide, along with the functional ranges. Okay, number 1. All right. So at the very least, grab that guide. But if you're like, you know what, I am fucking ready. I am ready to finally get some help and some support. Maybe you don't have, maybe you're not ready to get, say, for example, stool testing to rule out pathogens yet. That's okay. You save up for it, you wait, and you get that. But at the very least, you can get some support that you're probably not currently getting right now. How about fasting when you have hypothyroidism? Isabel, that's an amazing question. I'm really glad that you brought that up. You guys are going to hear me talk for like my voice double up. So bear with me for all of 2 seconds. Actually, you won't hear me talk twice, because I'm going to drop into my YouTube channel. I actually did a video previous to this that is, I'm going to grab it for you, all about intermittent fasting. But I will just let you know that this video was, is it okay if you can do intermittent fasting when you have adrenal fatigue? The same rules apply even with thyroid dysfunction. So Isabel and whoever else has that question, make sure you watch that video. It is a really great video that helps you break down, yes, intermittent fasting is okay if you have adrenal fatigue. Yes, it's fine if you have thyroid dysfunction. But how do women do it? When do they do it? Especially according to your cycle. It matters, okay? Oh, Dr. Farr is watching. Thank you so much, Dr. Farr. I super appreciate your support. So thank you for watching and tuning in. I love that. Someone else says, I am so ready. This is divine intervention. Definitely joining. Awesome. Well, I'm so freaking excited. Let me know what your name is, because I'm sure your name isn't, I love to be fit. Let me know what your name is so that when you do join, I can go, you've joined. So great to have you here. I get really excited being able to work with women and help them to decipher things, because you guys are not supposed to like catch all this information and go, okay, I understand it all. But that's the reason why we have a membership created, right? So anyways, guys, you have the information that you need to oh, you just became a Sexy Lady Baller. Awesome. Awesome. KB, I'm so excited. Make sure that if you guys join my membership, please post when you join. Tina. Okay, awesome. So Tina and KB just joined Sexy Lady Balls. Thank you so much. Please make sure that when you join, do me a favor, post in the group, do a post and go, hey, I just watched the live stream. So excited to be here, and tell us a little bit about yourself, because I do want to learn a little bit more about you guys so I can put a name to a face. Anyways, you understand what I'm talking about. Thank you, Melissa. You are amazing. Well, thank you. You guys are amazing too. And thank you for sitting with me for an entire hour. I said it was going to be 40 to 45 minutes. I lied. It was an hour live stream. But as you can see, there's a ton for me to talk about. And I literally could talk about this for hours more. No joke. My 15-year-old diagnosed with Hashimoto's. The question, Vicky, is why? Why are they diagnosed with Hashimoto's? What is behind it? And we have to investigate the gut. And we certainly can help your 15-year-old with that as well. Diane says, you'll love it. I'm a shedder. Good. Awesome. And if you guys are currently in Sexy Shed, I am going to be doing a live stream over there today, so stay tuned. But thank you all so much for watching. I hope that this was helpful. How does your membership work? Do we get one-on-one sessions with you? So for $57 a month, you're not going to get a one-on-one session with me because I'm worth more than $57 a month. Okay, with all due respect. Number two, if you want to get any sessions with any of our practitioners, you can, but you'd have to upgrade and obviously pay for their time because they are worth that time, and I have to pay for that, and I have to pay them. But you have to make sure that you get some level of testing. So if you have testing from maybe a naturopath that you saw from the last 3 to 6 months, we are happy to be a second set of eyes on that. Otherwise, you'd have to get some level of testing because in every single case, we cannot play the God one. We can't just be like, okay, I'm just going to guess based on your symptoms what's wrong with you. We can't do that. So the membership, check the link that I posted. All the information for the membership is there. That $57 a month, there's a 3-month commitment required, obviously, because if you're in, I want you fully in. I don't want people to half-ass shit because that's just not going to work for your hormones. It's not. I want people who are committed. But last but not least, it really does provide the basics. It provides the basics on food, supplements. It has specific protocols depending on the condition, and you get access. So for $57 a month with the coaching calls that you receive in that membership, with the access to me or my community managers who are nutritionists, it's absolutely fucking worth the $57. And if anyone's watching this and thinks, oh my God, that's still too expensive, then you're not the right person for the membership. And I can guarantee you're never going to find that any cheaper. And let me know, what would that be worth to you? Probably more than $57 a month. All right, that is pretty much it, guys. Thank you so much for watching. I super appreciate it. If you have not done so yet, please, please, please do me a favor, subscribe to this YouTube channel. I post videos every single Wednesday. There's so much more content coming up, and I do live streams like this once a month. So if you enjoyed this, make sure to subscribe. And right beside, there's also an option on the top right-hand corner of the screen. There's like a bell. If you hit that bell, you will get notified anytime that I go live, anytime that I post a video. It'll be super helpful. All right, guys, that is it. Thank you so much, and I will see you guys soon. Take care. Bye.